Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about posture, but not in the shallow way people often discuss it. Posture is not just stand straight or pull your shoulders back. Posture is how your nervous system, muscles, joints, eyes, inner ear, breathing pattern, and daily habits organize your body against gravity. Ask yourself this: why does your body collapse into a rounded shoulder position after hours at a desk? Why does your head drift forward when you look at a phone? Why does your lower back arch too much when you stand? Is it because you forgot to try harder? Usually, no. Very often, it is because some muscles are undertrained, some tissues are stiff, some movement patterns are poorly practiced, and your brain has accepted a certain position as normal. This is where power-based anaerobic exercise can become useful. I am not saying it is a magic fix. I am not saying it replaces physical therapy, medical evaluation, or treatment for structural spinal conditions. But when used properly, anaerobic training, especially resistance training and controlled power work, can help the body build the strength, stability, and motor control needed to hold better positions with less effort. Look at posture as a strength and control problem, not only a stretching problem. Many people stretch the chest, stretch the neck, stretch the hamstrings, and feel better for 20 minutes. Then the same posture returns. Why? Because the body goes back to the position it can support. If your upper back muscles, deep neck flexors, gluteal muscles, abdominal wall, and spinal stabilizers do not have enough endurance and strength, your body chooses the path of least resistance. Anaerobic exercise means exercise that uses short bursts of higher effort, powered mainly without relying on oxygen in the way long, steady cardio does. Think of resistance training: loaded carries, squats, deadlifts, rows, push-ups, hill sprints, kettlebell movements, medicine ball throws, and short intervals. For posture, we do not need reckless intensity. We need targeted intensity. We need strong signals to the muscles and nervous system. Start with this idea: posture improves when your body becomes better at resisting unwanted movement. Your spine is not meant to be frozen. It is meant to move, stabilize, and transfer force. When you lift a weight from the floor, your trunk has to resist collapsing. When you row a cable or dumbbell, your shoulder blades have to move and stabilize. When you carry a heavy object in one hand, your core has to prevent your torso from leaning. That is posture training in real life. Pay attention to the posterior chain. This includes the muscles along the backside of the body: calves, hamstrings, glutes, spinal extensors, upper back, and neck stabilizers. Many common posture patterns involve the front of the body becoming dominant and the back of the body becoming underused. Look at someone with rounded shoulders. The shoulder blades may sit forward. The chest may feel tight. The upper back may look collapsed. Now ask, what pulls the shoulder blades into a stronger, more stable position? Muscles like the middle and lower trapezius, rhomboids, rear deltoids, and rotator cuff. How do you train them? Rows, face pulls, reverse fly patterns, prone Y raises, and controlled pulling movements. But do not simply yank your shoulders backward all day. That creates tension, not health. Train the muscles, then let the posture become more natural. Now look at the pelvis. Some people stand with an excessive lower back arch and the pelvis tipped forward. Others tuck the pelvis too much and flatten the lower back. Why does this happen? Sometimes it is habit. Sometimes it is hip stiffness. Sometimes it is weak glutes or poor abdominal control. Sometimes it is pain protection. Anaerobic strength work can help by teaching the hips and trunk to share load properly. Do this. Practice hip-dominant movements. A hip hinge, a Romanian deadlift pattern, a glute bridge, a hip thrust, and a split squat can teach the body to use the hips instead of dumping stress into the lower back. Start light. Use slow control. Feel where the movement comes from. Ask yourself, am I bending through the spine or am I folding through the hips? Am I gripping my lower back, or am I using the glutes and hamstrings? Clinical exercise research supports the broad idea that strengthening and active exercise can help many people with back-related symptoms and function. Reviews on postural control also show that people with low back pain may use different balance strategies and muscle activation patterns compared with people without pain. This matters because posture is not only a shape, it is a control system. If your control system is poorly trained, your posture may feel unstable, painful, or tiring. Now let's go deeper. Power training is not just for athletes. Power means producing force quickly. In daily life, power helps you catch yourself when you trip, stand up from a chair, climb stairs, pick something up, or react to a sudden movement. How does that connect to posture? Your posture is constantly making tiny corrections. If the muscles are weak, slow, or poorly coordinated, those corrections become less precise. For many adults, safe power training starts with simple movements. Sit to stand with intent, step-ups, medicine ball chest passes, light kettlebell deadlifts, short uphill walking bursts, resistance bands pulled with crisp but controlled effort. The goal is not chaos. The goal is clean force. Start with strength before speed. This is important. If your squat is painful and unstable, do not jump. If your shoulder hurts during a basic row, do not throw medicine balls. Build the base first. Anaerobic exercise should be scaled to the person in front of us. A young athlete, an older adult, a pregnant patient, a person with osteoporosis, and someone recovering from surgery do not use the same plan. Look at the neck. Forward head posture is common in people who spend long hours reading screens. The head is heavy. When it drifts forward, the muscles at the back of the neck may work overtime, while the deep stabilizers in the front of the neck may not contribute well. Do this carefully. Chin tuck exercises, wall posture drills, and controlled rows can help train the neck and upper back as a team. Avoid aggressive neck loading unless supervised. If you have numbness, weakness, pain shooting down the arm, dizziness, severe headache, trouble walking, or symptoms after trauma, get evaluated. Now look at the shoulders. Many people try to fix rounded shoulders by stretching the chest only. Stretching may help, but add pulling strength. Use horizontal rows, band pull-aparts, face pulls, and external rotation work. Why? Because shoulder posture depends heavily on scapular control. The shoulder blade is the platform for the arm. If the platform is unstable, the neck and upper traps often compensate. Do not train only the mirror muscles. If your program is all bench press, curls, and crunches, you may reinforce the posture you dislike. Balance pushing with pulling. Balance front body work with back body work. Train the hips, not just the abs. Train rotation control, not just straight line motion. Core training deserves a careful explanation. The core is not only the six-pack, it includes the diaphragm, pelvic floor, deep abdominal wall, obliques, spinal muscles, and hip muscles. Its job is not to keep you stiff all day. Its job is to create enough pressure and control so your arms and legs can move well. For posture, use anti-extension, anti-rotation, and anti-side bending exercises. Try planks, dead bugs, bird dogs, Pallof presses, farmer carries, and suitcase carries. Ask yourself, can I breathe while I brace? Can I keep the ribs stacked over the pelvis? Can I move the limbs without losing trunk control? Breathing matters. If you live in a flared rib, overarched posture, you may rely on shallow chest breathing. During strength training, learn to breathe into the lower ribs and abdomen, then brace gently. Do not hold your breath excessively, especially if you have high blood pressure, heart disease, glaucoma, or are pregnant. Heavy breath holding can raise blood pressure. Ask a clinician or qualified trainer how to breathe during lifting if you are unsure. Now let's build a practical framework. Begin with a screening mindset. Do you have severe pain, fever, cancer history, unexplained weight loss, loss of bladder or bowel control, numbness in the groin area, progressive weakness, pain after a fall or accident, chest pain, shortness of breath? These are not moments for an internet exercise plan. Get medical care. If symptoms are mild and mechanical, start with 2 to 3 sessions per week. Keep the first session short. Choose 5 patterns: squat, hinge, pull, push, and carry. Add 1 posture-specific drill for the neck or shoulder blades. Add 1 mobility drill for the area that feels restricted. For example, start with a goblet squat or sit to stand, then use a hip hinge with a light weight, then a row, then an elevated push-up, then a farmer carry. Finish with a chin tuck or wall slide. Keep the effort moderate at first. Leave a few repetitions in reserve. Your body should feel worked, not attacked. Progress slowly. Add weight only when the movement stays clean. Add speed only when control is solid. Add complexity only when pain is not increasing. Why? Because posture training is not about winning one workout. It is about teaching your nervous system a better default pattern through repetition. Pay attention to soreness. Muscle soreness can happen after anaerobic work, especially in the first week or 2. But joint pain, sharp pain, radiating pain, worsening numbness, or pain that builds session after session is a warning. Do not push through those signs. Modify the exercise. Reduce the load. Seek professional guidance. What about scoliosis, kyphosis, disc disease, arthritis, or osteoporosis? Exercise may still be helpful, but the plan must be more specific. People with osteoporosis often need strength training, but they may need to avoid loaded spinal flexion or twisting under load. People with inflammatory arthritis may need adjustments during flares. People with nerve compression may need a plan that protects irritated tissues. Pregnant people should avoid certain positions and intensity levels depending on trimester, symptoms, and medical history. If you take blood thinners, have heart disease, uncontrolled blood pressure, diabetes, complications, balance problems, or a history of fainting, get medical advice before high-intensity intervals or heavy lifting. Now, why can anaerobic training be more powerful than posture reminders alone? Because reminders fade, strength remains longer, motor learning remains longer, tissue capacity improves over time. When you strengthen the muscles that hold the ribs, pelvis, spine, neck, and shoulders in better alignment, posture becomes less dependent on willpower. Think of your posture like the suspension system of a car. If the suspension is weak, you can tell the car to sit higher, but it will sag again under load. Strength training upgrades the suspension. Power training improves reaction. Balance work improves sensing. Mobility work improves available range. Together, they give the body more options. Do not obsess over perfect posture. There is no single perfect position you must hold all day. The healthiest posture is often the next posture. Move more. Change positions. Stand, sit, walk, lift, reach, breathe. But when your body has more strength, those position changes become easier and less threatening. Look at your day. Where do you spend the most time? If you sit for 9 hours, 3 workouts per week help, but they do not erase all the sitting. Set movement breaks. Every 30 to 60 minutes, stand up, extend the hips, open the chest gently, take a few breaths, and walk. Then use your anaerobic sessions to build the deeper capacity. Here is the key message. Posture is not corrected by punishment. It is rebuilt by training. Train the back of the body. Train the hips. Train the trunk. Train the shoulder blades. Train the neck gently. Train power only after control. Keep the work progressive, not reckless. If you want to begin today, begin simple. Choose a row, a hip hinge, a squat, a carry, and a breathing drill. Do them with clean technique. Repeat them twice per week for a month. Pay attention to how you stand, how you sit, how you breathe, and how you recover. Ask yourself, do I feel stronger against gravity? Do I fatigue less quickly? Do I move with more confidence? And remember, if your posture change is painful, progressive, associated with nerve symptoms, or linked to a known spine condition, do not guess. Get assessed by a qualified clinician. The best plan is the one that fits your body, your diagnosis, your strength level, and your goals. Posture is not just appearance, it is function. It is how your body handles gravity, load, fatigue, and movement. Anaerobic power training, done intelligently, can help restore that function by building the muscles and control systems that support you from the inside out. Take care of your body with patience, train with respect, and keep asking better questions about how your body moves. I'll see you in the next topic.